Welcome back, everybody, to the Megyn Kelly Show. Joining me now, somebody I've been wanting to talk to for months, author and journalist David Zweig. David, thank you so much for being here. I've been reading your stuff in New York Magazine, and it's been a delight because now I'll just show my own bias. I assume somebody writing in New York Magazine is probably a lefty and sort of catering to a more left-wing audience. Well, I don't know whether that's true about you or not. What I know is that your reports seem really fact-based and fair and not agenda-driven one way or the other. So you don't have to answer anything about your own politics. I just want to compliment you. Let's start with this, because here's just a sampling of some of the stuff you've written. The problem with the CDC's 6-foot rule for schools. Why public schools shouldn't offer a remote option this fall. New research suggests numbers of kids hospitalized for COVID is overcounted. And is the second shot giving young men a dangerous heart condition? I want to get into all of that with you, but let's start on the masks, because this article went viral. And then the title of that one, dated August 20, 2021, was "The Science of Masking Kids at School Remains Uncertain." Can you just tell us what this study was that nobody paid any attention to, except for you, apparently?
Yeah. So the CDC published a study that was a really large study of, I think it was 169 schools in Georgia. And it was something like 90,000 students. So this isn't, in like one school with 100 kids, 90,000. And what they found was that masking students, along with a number of other interventions, including HEPA filters, including distancing, including barriers, they found that none of these things, but as the thing that people are so focused on, which is masks, none of them had a statistically significant benefit, which means that they may have seen some benefit, but the way statistics works, that the sample size, the study wasn't powered sufficiently, which means there weren't enough people or there wasn't enough of a signal to say that this was statistically significant. And what really caught my eye was the fact that in the summary of the study, which is, unfortunately, what most people typically just look at a summary and that's it, including journalists, they didn't mention any of this in the summary. They mentioned that masking teachers, they did see an effect, a small benefit for that, as well as ventilation, primarily getting fresh air. They saw benefits. So those are the two things they added in the summary, but all these other what are called null findings, where you're not seeing a statistically significant benefit, those were, buried deep within the study. And of course, they were largely ignored.
And what's crazy is not about a month or a little bit more than a month after the CDC's own study of the 90,000 kids showing masks are of, looks like no benefit, they issued a mandatory mask order for kids in schools.
Yeah, I mean, to me, what I find most persuasive, perhaps even more than that one study, which didn't find a statistically significant benefit, is that we have to. I've done this with my reporting continually since the spring of 2020, which is I continually to look outside the United States, and I think that's been one of the biggest problems in the reporting on COVID in general, and then my area of focus specifically regarding children and schools, is that time and again, people are reporting on this, and not only journalists, but the public health authorities themselves issue decrees or give information without providing any context on how other countries around the world are handling this. And in regard to masks, there are countries throughout Europe, none of them are masking little kids. They're all at different cutoffs. Some of the countries, none of them are below 6, because the World Health Organization has repeatedly re-upped its guidance saying we do not recommend anyone under 6 years old wearing a mask. So, but beyond that, a number of the countries in Europe, it's not only below 6, they don't want anyone under 12 wearing a mask. And there are a number of countries that are saying no masks at all the way through secondary school, which is, their term for high school, only wearing them in a certain circumstance, like in a hallway. So what I think your listeners really need to understand, what I always try to do with my reporting, is look at not only what guidance is being issued in the United States, but seeing how or if our guidance is different from other places around the world.
And is there any evidence of more outbreaks in those schools that are not requiring the masking of children overseas versus American schools that are requiring it?
I have not seen any evidence in any sort of like wide scale way that shows that children in Europe are at a higher risk than children in America, relative to not wearing masks or, pinning it on schools being open or what have you. One of the problems, Megyn, is that continually in the media and also some of the public health authorities cite specific sort of anecdotes or examples as if and that's not how science works. We know this, that you need to actually look at the larger picture to see what's happening. So of course, you're going to hear about an outbreak in a school or many outbreaks. We have, 50 million children in this country. You're going to hear about things. The bigger question that people need to focus on is not some scary anecdote, but what is the broader picture that we're looking at? And time and again, study after study has shown that schools tend to have either the same or lower incidence of transmission than we are seeing in their surrounding communities.
Mm-hmm. It's like all the studies that you point this out in your piece that have taken a look at masks outside of this massive one, they just sort of tick them off as one of many things that were part of the preventative measures in the school and then say, these are the effective mitigation measures. But that's like me saying, okay, in order to prevent the measles, I wore a coat, I wore mittens, I used hand sanitizer. Oh, and I got vaccinated for measles. And then we just require all children everywhere to wear the coats and use the hand sanitizer. It's like that's not how science is supposed to be conducted in figuring out what is an effective mitigation measure.
Right. So I talk about this in the article, and you raise a very important point, which is the CDC has continued to recommend what they call a layered approach, where you're doing a whole variety of things with ventilation, with masking, with this, that, and the other thing, and HEPA filters, and the list goes on.
Plexiglass, social distancing,
all of it, yeah, and hand hygiene, and to what degree each of these individual interventions are beneficial. You can't tell if you're doing them all at the same time. There's no way to differentiate and know. So if you're throwing the kitchen sink at a problem, that's fine, and that makes sense initially. With sort of precautionary principle. If this is March 2020, of course, we appreciate no one knows what's going on. We're, wiping our groceries down with bleach or whatever. But
I never did that.
Yeah,
never.
That's wise. But you can't continue doing a long list of things without looking at them individually and then claiming that they all work as you said, if you're wearing mittens and pants and all these other things. So, but that's exactly what the CDC has been doing, that they say, we know masks work because there's a low incidence of cases in schools while they do masks and ventilation, et cetera. And a number of the experts who I've spoke with for the article and who I talk with on a regular basis, and these are infectious disease specialists, epidemiologists, and aerosol scientists, have said it's entirely possible that almost the full benefit of the low transmission in schools is related to ventilation. That's entirely possible, and that masks maybe provide a marginal or no benefit at all. We don't know. So to continue to insist that it's masks when you're doing a whole variety of things is unscientific. Now, people continue to say, well, but we know masks work. We know they work. And I'm not an anti-mask person necessarily. There is good evidence, I think, that some masks do work in some circumstances. So it's not that there's zero benefit of masks, but there's a difference between a kid wearing a mask in school that they bought off of Etsy or Amazon or something for 7 hours in a classroom versus an adult wearing a well-fitted N95 in a healthcare setting or popping into Costco for 20 minutes. Mm-hmm. These are very different environments. So there needs to be a lot more nuance, I think, in how the guidance is distributed and how we look at the science.
Especially when you look at the CDC's guidance that 2-year-olds need to be masked all day. 2-year-olds. Sure, anybody with a child understands how easy that is, how compliant they are, how they're definitely going to keep it over their mouth and their nose all day long. And it's like, I think the CDC has said, okay, you can take it off during their school nap time. Oh, thanks for that. So they don't suffocate. We appreciate that, CDC. A 2-year-old who's got virtually no risk from COVID, but does from your mask. By the way, I had no idea that there was something called an aerosol scientist job. That's something to consider if things fall through here.
Right.
I do want to talk about Delta, though, right? Because this is what we're hearing now is, okay, David, But this article was dated August 20th, and the CDC study was, 6 weeks prior to that. And dun, 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 Delta has changed everything. What say you?
So what's interesting, I'm writing a book on the topic of kids in schools. And one of the challenges I've been confronted with as I work on the book is that, the story keeps evolving and there's new things. There's the new, and after Delta, there'll be Lambda and Epsilon. We're going to run through the Greek alphabet. But one of the things that has kind of crystallized for me is that the same themes repeat themselves. And one of them is that I'm not minimizing Delta. It is more contagious, but the evidence is very mixed at best as far as Delta being more virulent. And the same fundamental things apply regarding masking or other things, if you're still specifically referring to kids wearing masks in school. One of the scientists who I spoke with gave me a good analogy. He said, look, imagine you're wearing kind of a junky old raincoat. Maybe it's ripped in places, it's very thin, and you wear it it's drizzling outside. And you're going to get wet. Some of the water's going to leak through. Now, if that's the benefit of that kind of junky old raincoat when it's drizzling, what do you think is going to happen with that raincoat if you wear it in an absolute downpour? So that was the sort of like metaphor he gave for if masks are at best perhaps marginally beneficial in schools before Delta, what makes you think they're going to be beneficial after Delta, which is even more contagious and more transmissible?
You look at the numbers of children now being hospitalized and so on. And we're going to get into this with our next guest too. And it has a lot of parents alarmed, but there's a question about whether it's that more kids are that doesn't necessarily mean that more kids are dying or actually suffering from severe disease as a result of COVID. What the media does is it takes cases and it takes any kid who's in the hospital with COVID as evidence that COVID put them in the hospital, and then they scare people without a lot of context.
So yeah, this is another great point, and it's an important one. I wrote about this. I broke the story on 2 peer-reviewed studies that were published by a journal put out by the American Academy of Pediatrics. And both studies, they were done independently of each other. Both of them found that at least roughly 40% of the pediatric COVID hospitalizations were incidental or were for cases that were not significant. And this could be, for example, a trauma, someone breaks their ankle, you're in the hospital, automatically the hospital tests you for COVID because that's the policy. Boom, that's a COVID hospitalization. So they found 40% of what we are told are COVID hospitalizations are not necessary for pediatric cases, are not necessarily because the child had severe symptoms of COVID. They could have been for any number of other things that send people to the hospital. So to me, anytime you see the pediatric hospitalization numbers, bear that in mind. Again, this is not my opinion. This is from 2 peer-reviewed studies that were published by the American Academy of Pediatrics.
So there's not, as far as your research shows, again, we'll bring this up with our doctors coming on next too, there is not a greater risk of hospitalization or death from the Delta variant in children.
Well, Delta is more contagious, all the evidence seems to show. So if you have a larger denominator, meaning if more and more people are becoming infected, it makes sense, you're going to see an uptick in hospitalizations. Through whatever it is, in particular children, if they're unvaccinated. But again, that doesn't mean necessarily that Delta is more dangerous on an individual basis to each person who becomes infected. There's also some really interesting information, which is that an unvaccinated child, based on certain metrics, is actually at the same or lower risk than a vaccinated adult. So this notion of the kind of like panic around kids, I totally appreciate it. I have kids. I don't want my kids to be sick. No one does. That's normal. But what's happened is because I think largely of the media environment that we're in, coupled with some of the public health messaging, that people's perception of the risk has divorced from the reality of the risk. It doesn't mean it's zero. Of course, some kids are going to become sick and have become sick. Unfortunately, some have even died. This is not something we want. But the world is filled with risks. And when you look at the risks of COVID to your child versus any number of other things, it's way, way down on the list. I mean, look, more than double the number of kids die drowning each year than they have from COVID, for example. I mean, we could start ticking off a list, whether it's drowning, car accidents, suicides. All of these things present risk to children at a different scale than COVID ever has, including even during the era of Delta.
I was reading a Washington Post piece talking about, the pediatric cases, saying that they're surging as children head back to school. Again, cases is not the relevant metric. We're going to have cases. There's a pandemic. There's this thing called COVID, and Delta is really contagious. Cases is not really what we should be looking at, but it's what the media touts. But the Washington Post talking about how the pediatric COVID cases surpassed 250,000 for the first time since the start of the pandemic. Most are not severe, they add, but nearly 2,400 kids were hospitalized nationwide with COVID. Again, with COVID, not necessarily because of COVID, in the 7 days ending this past Tuesday. All right. And then they go on to talk about how, hospitalizations for children seem to be sharply increasing as Delta surges to the point that you just made. And then they go on and say that they've gone up a lot, though it remains slightly below the January peak, the number of hospitalizations. And then at the very bottom of the article, Dave, they say, but based on the limited data available so far, it does not appear that the Delta variant is affecting the incidence of severe disease or deaths among children, which have been somewhat steady and relatively low throughout the pandemic. So it's basically like, we're going to scare the living daylights out of you and then tell you, actually, nothing's changed other than it seems to be a little bit more contagious. Just what you just said.
I mean, I'm communicating with pediatricians at top university hospitals around the country, basically on a daily basis, pediatric immunologists, as well as infectious disease specialists. And depending where you are, the hospitals are not overflowing. It doesn't mean that there hasn't been a spike in cases in different areas, but as you noted, the actual risk to children of severe illness does not appear to be any more significant than it was before, even if Delta is more contagious. And again, I find those two peer-reviewed studies very persuasive and compelling regarding the sort of, as you noted, the if you're hospitalized from COVID rather than hospitalized with COVID. One of the things that's been rampant is a infectious virus called RSV, along with a number of other respiratory viruses. From a number of experts I've spoken with, that is what we're really seeing a high prevalence of, and that's actually really dangerous, particularly to little kids. So what they believe is happening, at least for a certain segment of them, is a kid comes into the hospital, they very well may have a co-infection. You may have RSV and you may have COVID. But that's always going to be checked as a COVID hospitalization because they can run a panel and they test for all of them. So if it comes up positive for RSV, for COVID, for something else, you still are marking off the COVID box on there. But the data given to, regular citizens, all we know is, a kid is in there for COVID. But that's not necessarily the case if there's a co-infection.
For COVID is not the same as with COVID. It's like if I'm walking around with, basal cell carcinoma on my face and God forbid somebody shoots me and I go to the ER and I die from my gunshot wound, you could say I died with cancer, but it doesn't mean I died of cancer. It's an important distinction. All right, coming up, Dave and I are going to discuss the new emails showing the CDC completely bowing down to the teachers' unions on mask mandates. They weren't going to do it. Then the teachers union objected, and that is why your kids now have to wear these masks in a lot of these schools. Do you have a thought about what your school district is doing? Call me. Tell me about it at 833-44-MEGYN. That's 833-446-3496. Welcome back to the Megyn Kelly Show. Continuing now with my conversation with author and journalist David Zweig. So Dave, one of the things we saw this week is that the CDC didn't really appear ready to issue mask mandates. The American Academy of Pediatrics had been calling for it, but originally the CDC wasn't saying we're going to do that. We're going to recommend that for kids in schools. And now we know the teachers union got involved and had one-on-one conversations with the CDC muckety mucks, and suddenly they shift. And it appears to be as a direct result of pressure from the teachers unions, which is crazy to me considering that in New York City, something like almost 40% of the teachers declined to get vaccinated, but they want me to mask my kid to make them feel better.
Yeah, I mean, I think the interesting part about this story, rather than the sort of gotcha of like, look, we know they're colluding, behind closed doors, or so to speak. I mean, not that that's not important, but to me, the bigger story is why are they doing this if we know that vaccination and ventilation are far more important for mitigating the spread of COVID? That it's become a bit of a distraction, more than a bit. This kind of like battle over masks. Again, you're not seeing this kind of like hyperbolic conversation and emotional thing regarding it in most of Europe, when kids there are not wearing masks. So to me, the thing that the takeaway of the teachers union thing is less about what's going on with influencing the policy. Again, not to say that that's not important and worth looking at, but it's more about the idea, if an adult is vaccinated, they're at, and barring having some sort of underlying conditions, they're at incredibly low risk. And all adults in our country have now had the option to be vaccinated, should they so choose. And we know that kids are at incredibly low risk. So you have to ask yourself, to what end? Yeah. What exactly are we making little kids wear masks all day for what's now going to be years of their lives? Years, not a week, not a month, but for years, all day, every day in school. And you have to ask, why? What are we accomplishing? Who are they protecting? We know that kids are at incredibly low risk themselves. It's not zero, but it's very low. And we know that adults who are vaccinated are at incredibly low risk of severe illness. So what are we exactly trying to achieve? And when you look to many countries in Europe, clearly they have come to a different conclusion than we have here. And I find that fascinating. It doesn't mean that it's apples to apples. Of course, every country is different. But I looked up, Megyn, I looked at the vaccination rates, the overall per capita mortality rates, and the current case rates within all these different countries in Europe, and it's all over the map. It's not like all of them have higher vaccination rates or all of them have worse case rates or mortality. It's up and down. The US is kind of in the mix with all of them. Yet the one unifying thing amongst those countries in Europe is that they're not making little kids wear masks. Mm-hmm. And in many circumstances, they're not making any kids wear masks all the way through high school.
One of the frustrations is, what are the metrics? When do the masks come off? What are we waiting for? And will anybody tell us? Well, they won't. And wait until you hear what Rochelle Walensky, who I think is she's a hysterical person, is saying about that. We'll pick it up next when we pick it back up with Dave, and then our doctor will be joining us. Don't go away. Welcome back, everyone, to the Megyn Kelly Show. Coming up, Dr. Vinay Prasad. He's here to answer any of your questions about COVID. That'll be fun by calling me at 833-44-MEGYN, M-E-G-Y-N. That's 833-446-3496. Get your questions about the vaccine, about boosters. We're going to get into that. About masks, ready. First, though, we're going to continue my conversation with author and journalist David Zweig. David, okay, so we talked about why it looks like the CDC reversed itself and said, oh, we do have to have mandatory masks in the schools because the teachers union, many of whom will not get vaccinated, I think, this is my theory, they want my kid to wear a mask because they've chosen not to get vaccinated and they think that's going to protect them, whereas it should be exactly the opposite. They should be getting vaccinated as the grown-up to protect my kid, who should not be forced to wear a mask. But anyway, I want to get back to their justification, because you as a journalist did what most people don't do. And when they issued that new guidance saying, you know what, actually, we do want mandatory masks for everybody in these schools, you called them up. And you called up the American Academy of Pediatrics too, which was recommending the same, and said, said, give me your data, to explain what you said and then explain what they gave you.
Yeah, for the piece I wrote for New York about the masking guidelines in schools, and specifically regarding this Georgia study, one of the things that we hear all the time is, we know that masks work, and just sort of, and you're a piece of garbage if you disagree with that. And I'm approaching this apolitically. I'm not a Republican operative or someone who's against masking on some sort of like freedom or libertarian standpoint. I'm just looking at the science. And what I did was, not only did I reach out to the CDC and the American Academy of Pediatrics, but I reached out to a handful of very prominent public health people who, doctors who you see on TV all the time, who have really large Twitter followings, and some of whom who I have a sort of private dialogue with. And I reached out to them privately and said, hey, I know you are really in favor of kids wearing masks in school, please send me the best evidence you've got. What do you got? And it was incredible. I mean, one of the people, the first thing she sent me was a study from Massachusetts, which was where they found that there was no benefit of 3 feet versus 6 feet in the classroom. And I said, that doesn't say anything about masks. She sent me something else about a Wisconsin study. I said, that doesn't say anything either. And I saw this pattern over and over, that when you actually push some of these people, show me evidence that masks work on kids in schools. They're sending you stuff, as we talked about earlier, where they're doing masks with a whole variety of interventions. And on the CDC's own website, where I went through point by point, there was a zillion different citations for studies. I made a huge spreadsheet. I went through it with an epidemiologist to make sure I wasn't confused, because I'm not a medical expert. So I had an expert run through it with me. And every one of these studies that they were citing, either A, were the low transmission rate may have been due to any number of factors. It could have been masks. It could have been just because they're children and they're less likely to become infected to begin with. It could have been because of ventilation. That, or they had a thing where it was in a hair salon, or they had something. Incredibly, a number of the studies that the CDC cited actually didn't have kids wearing masks at all. I'm like, how is that listed as evidence? So there's a lot of stuff, when you start digging into the details, don't quite add up. I will say this, it's possible that masks do offer some marginal benefit in schools. What I'm saying is we haven't seen sufficient evidence, and the one study, and the CDC themselves, they say this is the only study that's done this, where they're looking at different cohorts in schools, where they said we're comparing schools where they did use masks and where there wasn't a mask mandate, didn't find a statistically significant benefit. And that was with 90,000 students. So it's entirely possible there could be some benefit if we have a larger pool. If we bump up to several 100,000 or 1 million kids, we might see some benefits regarding transmission. We don't know. But then you have to ask, and a woman named Tracy Hogue, who is an epidemiologist, and she was a senior author on another study published by the CDC, she made the point, she said, at what point do we then have to ask, is it worth this marginal benefit? Remember, a case is not the same thing as illness. Those are two different things. And just becoming infected doesn't mean you're ill. According to the CDC, they estimate that it's possible up to 50% of children who are infected are asymptomatic. So that's a really high bar to clear if half the people who are infected don't even know it, as far as, being kids. So I think these are all these sort of nuances that get lost. Now, maybe I'm not an expert in public messaging from the government, so maybe they feel that making a very blunt recommendation is the only way to do things. But we can see in other countries around the world that they are doing very different type of advice, whether it's for masks, whether it's for vaccinating kids. You may have seen, Megyn, just recently, the advisory committee in the UK recommended against a blanket vaccination for 15 to 17-year-olds, for 12 to 15-year-olds. That's very different from the guidance here in America. So these are things, again, I'm always looking elsewhere. It doesn't mean that their country functions the same as ours, but boy, that's quite a different conclusion for an advisory committee in another major Western country to say, you know what, we don't think it's the best idea. Unless your kid has severe underlying conditions, we're not going to recommend that everybody get vaccinated, the 12 to 15-year-olds. That's very different. As you know, we are speeding toward approving a vaccine for kids under 12. So that's quite an interesting contrast. It doesn't mean they're right and we are wrong, but to me, as a journalist and someone who's just curious, it does raise questions about why are they coming to a different conclusion than we are here.
Me too. Me too, as a journalist and as a mother, as a parent. Can you just tell us what happened when you contacted the American Academy of Pediatrics and said, what data did you base your recommendation on?
Right. What happened was I was met with crickets, and the CDC, interestingly, sent me back like 2 studies that had absolutely nothing to do with masking students. And then they had kind of a banal statement about the Delta variant, and we think everyone should wear masks. So neither of them. But I gave them the benefit of the doubt, even though they didn't send me the best study, as I mentioned before. I went through and started reading every single citation they had in their guidance to see maybe I'm missing something.
Yeah, you tried to steel man their argument. You were unable
exactly. Like maybe I'm missing something. Let me keep digging and digging. And by the way, I also reached out to, a dozen different specialists who I talk with on a regular basis. Hey, am I missing something here? And that's the thing that it's worth looking at. It's not that we're automatically wrong and other places are automatically correct, but you have to actually look at what's being recommended elsewhere. And you have to actually, I recognize the average person, I guess that's why I'm here. The average person is doing a different job than I'm doing. They don't have time to start pouring through, CDC studies and whatever else and seeing this stuff. So of course, they're not going to be aware of this. And kind of dovetailing with that point, I keep mentioning looking at other countries. But the other really important piece of context I found, Megyn, and this is something that's going to be a really big theme in my book, is that there is a fair amount of dissent within the medical community and public health community to what's being messaged, but people are afraid to speak out. From the beginning, I've had doctors and others and epidemiologists and others reach out to me and say, thank you so much for writing that article. I really strongly disagree with what's going on. But then they won't talk on the record. And I have a long list of people who I talk with on a regular basis. And either they are explicitly told, if you are at a major university hospital and the chair of your department says, you're not doing it, don't speak out against, the guidance, or it's implicit. You just know there is this is within your field. You have colleagues, there's a group think going on. It's a big deal if you're a doctor to actually speak out against the CDC. That's not something that's easy to do. So there are both explicit and implicit kind of baked in reasons why people have been discouraged from speaking out. And I'd say, and then
we talked to a guy who was on the CDC advisory, the vaccine advisory group, and he spoke out against where they were going with it. And he probably got booted off the group.
Yeah, that has happened with a number of people, and there's enormous pushback against others. This is sort of the last piece I was going to say. It's not just about your boss or your colleagues, but the people who do say it. And I face this pushback as a journalist as well. If there's any questioning, any sort of doubt against the sort of popular narrative, you're automatically, not only are you wrong, but this ad hominem attacks that you're a bad person, you want to kill people, you're a lunatic. But again, is everyone in the UK and Denmark and Sweden and Switzerland, are they all lunatics? Or do they want children to die there? So I think to me, one of the biggest things, Megyn, is that there's this complete squashing of debate, and particularly on something related to science, that it should be not only reasonable, but expected for there to be dissent and for there to be discussion. And for it to not be these ad hominem emotional attacks where you see certain doctors or epidemiologists with a big Twitter following who are completely smug and obnoxious against journalists and against some of their peers.
I've heard it said that science is a verb, not a noun. And, it's an ongoing process where new information gets added and new conclusions are reached. And that's why it's so frustrating. I mean, I'll tell you at our school, which is very, very tough on all the COVID things, like mandatory masks all day long and mandatory vaccinations now for any kids who are 16 and up, or you're expelled. I mean, that's crazy when you see about, as you point out, what's happening in other countries, and there are side effects and so on that some of us need to worry about. Anyway, they presented a doctor from Yale New Haven, and the doctor was very pro-mask and very pro-vaccine. It's like, well, you know what? I would love to hear a doctor who has a different opinion than this guy's, because this guy does not represent every doctor, and be able to make up my own mind. But of course, we're intentionally spoon-fed different, just what the school wants us to hear. All right, let me ask you about Rochelle Walensky, because I know one of the points you've been making is that the mask mandates, the masks in general, they have no endpoint. There's no specifics being offered to us about when can I take the mask off of my child? And here's what she said. This is, everything she says is just so out there. Remember she cried? She's like, anyway, okay, sorry. That's me, Dave. She said, if our children are vaccinated, we have full vaccination in schools. We have full vaccination in teachers. We have disease rates that are low. I think then we can start thinking about how we can loosen up. Okay, so basically there has to be zero COVID is essentially what she's saying. And then maybe we can start thinking about taking off the masks. I don't even know what to do with that.
Yeah, I mean, and I quote a number of experts in my article who speak to this exact issue, and it's a real concern that the term du jour is off ramps. There's no off ramps. One of the reasons I think why they're not coming up with specific metrics is that they would be made up. No one knows. No one knows the specific community rate or whatever else that you should tie
I've got
to
one.
mask
I
usage
know.
when they
Once
should.
the teachers union says it's okay, then we can take off the masks.
Right. I mean, so that's one of the problems is that we don't actually have a good sense of when it is or isn't appropriate. And this kind of gets to a larger issue, just sort of like pulling the lens back that I think about a lot, that also I hope to, put in my book in a really big way is we also have to ask, who are the people making guidance for how society should run? And at the beginning of a pandemic, it's entirely appropriate for those people to be infectious disease specialists and others in that area because no one knows what's happening and there's a panic and we have to prevent a catastrophe. But we are now a year and a half into this. And at a certain point along the way, you need to bring in other people, whether it's child psychologists, pediatricians, economists, there's philosophers, there's a variety of people whose voices and opinions, because mitigating a virus is not the same thing all the time as human flourishing. And so it is not, I'm not here to minimize COVID. I mean, COVID is horrible and no one wants anyone to get sick, let alone for people to die. But we have to understand a context of COVID versus other things. I mean, to me, one of the most persuasive things is when you look at, in 2018, 2019 flu season, I think it was 477 kids died. These are the CDC's numbers. Yet in COVID, the number is something around 400 in a much, much longer time frame. That's cumulative over, a year and a half. So we've had fewer children die from COVID than they did in a much shorter flu season. And by the way, remember those numbers, that's without subtracting this roughly 40%, according to those two studies about, the sort of with versus from argument. So the numbers really change. Oh, and I'll take it one step further. With the flu, they don't do universal testing typically when a kid goes in. So these comparisons are very specious about, with the flu versus COVID, that CDC has made in the past, saying that COVID is more dangerous than the flu to kids. There's really no evidence of that.
Oh, wait, I got to ask you this because we're a little short on time, but I really need to ask you about the side effects of the vaccine because I know you did an article as the mother of 3 kids, 2 of whom are boys, and this particular side effect seems to affect boys more than girls. You did a piece about the heart inflammation it's recognized, it's been announced by the public authorities too, the CDC and others. Heart inflammation that's coming from the vaccine in some cases, not a huge number, but a statistically significant number in boys who get the vaccine. So what did you find when it comes to that side effect and how concerning it is?
Well, what we did find is that there certainly, and this is the CDC's own number, so I'm not making, it's not me making up the numbers, it's from the CDC when they had their advisory committee meeting about this, that the number of young males who had what's called myocarditis, this inflammation of the heart, or pericarditis, that's the inflammation around the heart, that the numbers for young males were like off the charts. It was something like 60 something per million, where they had expected 0 to 4 per million. And the thing that bothered me was, and it bothered a number of other, it bothered a number of specialists who I spoke with, was that when you merge different groups together, which is what the CDC did, they took young males and combined them with young females. But the females had an entirely different risk perspective than the young males. So, and then on top of that, they took young males and young females and made it co-ed and took it all the way up to age 39. And they said, hey, look at this. There's only 12 cases per 1,000,000. Well, sure. I could just, you can keep making the pot bigger and bigger. Where, you get the point where you're going to bury the signal amid the noise. So I just couldn't understand why you would possibly do that when the evidence is actually there to differentiate. And I keep mentioning this, but other countries are coming to different conclusions about whether it makes sense to just, boom, vaccinate everyone immediately. I'm not against vaccination. I'm vaccinated. And I think the risks are, relatively speaking, very, very low. So I think, to put things in context, the risk of COVID to a healthy kid is incredibly low. And the risk of the vaccine to most kids is incredibly low. But when you look at the actual numbers and how they weigh out, it's not as clear cut as the CDC has made it seem. And again, there are other public health authorities who are coming to different conclusions about it.
Mm-hmm. Yeah, I mean, this is how I feel. I said this to Dan Abrams. We had a little spar on his Sirius XM show yesterday, saying, look, you know, in my own family, my dad died at age 45 of a sudden heart attack. I've got a heart issue. It's a thing in my family. And the last thing I want to do is anything that would in any way compromise my boys' hearts. I mean, every parent feels that way. And some of us have extra medical reasons to feel that way. And so I do not want Rochelle Walensky or our head of school or anyone else telling me I've got to risk their heart health to protect against a virus that they are at absolutely next to no risk of being hurt by, right? They don't have any of the immunocompromising factors that would lead to, you know, death or hospitalization based on what we've seen so far. So it's just trying to get people to understand when it comes to one's children, like, we have a responsibility. We got to be careful. I have to advocate on their behalf. They're not 18. People, you know, Joe Biden today is going to make a hard push for mandatory vaccinations, and it's common for kids and mandatory vaccines. And I just think people need to keep in mind there are all sorts of reasons why these mandatory policies, with very few allowed exceptions, by the way, are problematic. Dave, you're amazing. I hope you come back.
Thanks for having me.
Anytime.
If I said it, I meant it. Bite my tongue for no